For the fourth consecutive year, the U.S. has earned a grade of D+ for the number of babies born before 37 weeks of pregnancy.
By the way, that's not okay.
No.
It's a very low mark coming in a report card released today by the March of Dimes, a maternal health nonprofit. They're just telling you the truth. That report shows roughly a quarter of pregnant women in the U.S. do not get necessary prenatal care in their first trimester.
So joining us now with more is ABC News medical correspondent Dr. Darien Sutton. And Dr. Sutton, a D+ for the fourth year in a row. I looked at the study because it really breaks down state by state, county by county. You can see how well you're doing depending on where you live. How does this get better?
You know, it's concerning when you look at these numbers because it's more than a report card. It reflects real lives that are affected every day by the policies that are changing and affecting them. And I think it's so important to understand that this is not a result of something that mothers are doing wrong, but a result of a system that is not built to protect mothers and babies as best it can. Unfortunately, we live in one of the wealthiest countries in the world, and we have one of the worst rates in terms of maternal outcomes. Even more worse for black mothers in this country.
It's just, it incenses me. And it's not as if the work is not being done because people like your brother, Dr. Desmond Sutton, isn't he the head of labor and delivery at Mount Sinai?
Yes, he works extremely hard communicating, but he sees every day how difficult this journey is for many mothers, especially those starting this journey with limited access in their first trimester.
And with a massive team, but still. Now this report, it shows babies born to black mothers are 1.5 more times more likely to be born prematurely. So what's behind the racial disparities?
You know, for this answer, it is a complex one and probably deserves its own entire discussion point because we can talk about it for hours, but really what it comes down to is this is not a factor of biology. There is not an issue with black mothers that leads to worse infant mortalities. It's a result of systemic and structural barriers, unfortunately, that overlap in many black communities. We're dealing with limitations in access, barriers to getting insurance coverage, and we're seeing hospitals in predominantly black communities close down. And as many of you know, a pregnant woman visits the doctor at least 10 or 12 times during their pregnancy. When you have to make that trip 3 to 4 hours sometimes in some of these states, that can be a barrier within in and of itself.
I can't think of anything that's more important than a healthy baby being born to a mother, but yet we can build AI infrastructure, we can build cloud infrastructure, we can spend hundreds of millions and billions of dollars on technology, but we can't help mothers have healthy babies in America? Okay, so we mentioned earlier that a quarter of the pregnant women are not getting prenatal care. Why is that early window? Why is the early care so important?
So important because that's where a lot of the prevention happens. A lot of the genetic testing, screening for diabetes, screening for high blood pressure, and the treatment starts there. And if you start treatment early, that reduces your risk of long-term complications, that reduces your risk of premature death, that reduces your risk of premature birth, and that reduces your risk of complications that can happen after pregnancy as well. And so it just really focus in on this point, a significant percentage of women are not able to see a doctor within the first 3 months of their pregnancy. What does that tell us? That women are navigating this difficult journey alone. Without headlights in the dark.
I can't even imagine, like you're in heavy rotation with your doctor.
Yes.
You get to know them on a very intimate level because you're going like every week, possibly several days within a week. Tell us, what can expectant mothers do right now to protect themselves and their babies? They may not have the resources, but what can they do despite being in an underserved community?
You know, being proactive and advocating for yourself is so important. Making sure that you get to the bottom of any symptom and making sure that you're getting answers that you can fully understand. And if you're having or needing a second opinion, doing the work to find that opinion, making sure you're also screening for things like blood pressure, diabetes, and really talking to providers about your discomfort and your pain. And again, not being afraid to ask questions. But as a point, just to belabor this, it's not a focus on moms that are causing these outcomes. I think it's so important for mothers out there to understand this. This is a result of structural problems that could be prevented because we see when we look at different states, it is not the same. And so one of the reasons why is because every state has different points of access. And so we need to work harder in terms of public health providers, advocates, and even our policies to make sure that they structure and support moms as much as possible.
And if you guys are curious, the only state with an A rating is Massachusetts, New Hampshire, Oregon, California, they're in the B's, tri-state area, as you saw there in the C's. But if you go borough by borough, I looked at the Bronx, they're D+.
Yeah.
The Bronx is in comparison to Manhattan, which I think is a B. I'll have to look at it, but it's disparities by county by county.
It's just not okay. To me, it indicates a headline that we see. We talk about failure of the medical system and a difficult medical system, but when you're talking about people's lives, that's the real result of this problem.
Absolutely.
We have had this conversation so many times. We've had them many times with you, your brother. It's sad that we have to keep talking about it, but I'm so glad you came on.